Welcome back and thank you for staying with Bottomline Africa. Now I want us to talk about youth issues. The youth are the future generation and their well-being and health is key. But let's take a look at where we are right now, and joining me is Job Akuno, who is a technical lead adolescents and youth at the Elizabeth Glacier Pediatric AIDS Foundation, a non-profit organization dedicated to preventing pediatric HIV infection and eliminating pediatric AIDS through research, advocacy and prevention and treatment programs. Now, the organization provides policy and programmatic support to youth health in Kenya. Thank you very much, Job, for joining us here on Bottomline Africa. Maybe we can just start by you telling us the status of young people's health and well-being, not only in Kenya, but in the region.
Yeah, thank you very much for inviting us to engage in this conversation. And as you have rightly pointed out, the work that we do really helps us to focus on addressing the HIV as well as other health issues affecting young people in Africa. And it is true that when you look at the young people, who are roughly a third of the population of the Southern Africa region, you will notice that with this bulge in population, we are also confronted with a number of challenges when it comes to the health and well-being of these young people. Of course, pointedly again, it is important to note that AIDS remains a leading cause of death among the adolescents and young persons in Africa, while it is a second leading cause of death globally. So that means that when you look at the adolescents and young persons, then you're looking at a population that is already challenged by the HIV and AIDS pandemic, and now more so with the emergence of COVID, then the burden on this population is even heightened. We are looking at, again, the population facing a number of barriers when it comes to accessing sexual and reproductive health information and services. As you probably remember, Kenya is among, for example, the signatories to the commitment within Africa to address the comprehensive sexuality education among adolescents and young persons. However, we know that looking at the progress made so far, it has been a challenge in Africa to actually provide for the comprehensive sexuality education for young people. Again, we are also noticing that with an increasing level of a transition of young people into higher education institutions, these young people who are coming from probably levels of educations where they were used to a lot of restrictions and the like from parents and guardians, now when they get to the colleges and universities, then the new acquired freedom is actually leading to a rising number of cases where we are seeing a lot of gender-based violence directed at especially the female students in our universities. We are seeing rising cases of adolescents and young girls in our universities getting pregnant very early and unplanned because, again, there is lower access and utilization of dual protection services among this population. We are also seeing a population that is experimenting with sex without adequate knowledge on prevention broadly, which then means that we are actually dealing with consequences of some of those decisions that young people take without adequate information.
All right, you've talked about... Sorry, just continue before I ask the question. Maybe you can finish your point.
Yes, I was also saying that with this kind of population that we are talking about, we are also seeing a higher number of younger girls out of vulnerabilities and poverty, being orphaned and vulnerable and all that. We are seeing that most of those young people are actually entering into relationships with older men or who are more experienced, and therefore they lack the opportunity or the bargaining power to negotiate for safer sexual practices, among others. And therefore, these are some of the issues that face young people when it comes to their health, and therefore the need to broadly address some of those issues if we are to actually reap from the bulge of adolescents and young people that is within our populations. Yes.
Okay, Job, you've talked about sex education, which has been among the talks that have been having, people have been having the past few months because of the issues that you've mentioned, gender-based violence, early pregnancies, and so on. Why is it that implementation of sex education is a challenge? Is it the policies?
I would say that it's a number of factors. One, generally growing up in an African family, sex is a taboo subject, so it's not talked about. And therefore, the young people are growing up without parental or any caregiver information that is coming up on sex and sexuality. And that's largely because, again, our family has become more nuclear in nature as opposed to the previous extended families where we had aunties or uncles who played those roles. Then when you come to the schools again, schools is one of, we do a lot of transmission of values and communication in school. Again, this is an area where there's been a lot of parental as well as religious leaders input in terms of what can be taught and what cannot be taught. And the perception has been that discussing matters of sex and sexuality with adolescents and young people or children in school is likely to lead to moral decay, which of course we know is not necessarily the case. Two, we also know that young people spend a lot of time within religious institutions. Again, the religion generally looks at matters of sex and sexuality as something that is still a taboo and not talked about. I think a number of churches probably have family life education, which is only done for married couples and the like. So the question is, if the young people are not brought up, talked to about some of these issues like sex and sexuality, when will they know? Will they eventually wait until they're in marriage for that conversation to occur? In terms of policy framework, I know that the country is a signatory to that comprehensive sexuality education partnership that was signed by African state. However, in terms of the execution of that, there's been a bit of shyness in terms of how to go about it, especially with a number of oppositions coming from a number of quarters and actors who have a say over some of the ways that we communicate around sex and sexuality. And so that is one of those critical barriers that we need to surmount.
All right, you said your organization provides policy and programmatic support to youth and health in Kenya. You've talked about the challenges that we are facing in general, not just in the country, but in the region. The fact that, number one, we have our culture and our religion. We are aware that information is power. So then where do we go from now? Now that we know our problems, how do we solve them?
I think the population and development has been playing a critical role in terms of galvanizing, the coordination and support for some of this conversation at the national level and bringing together all these actors, right from the stakeholders in education, stakeholders in health sector, stakeholders within the civil society, as well as religious leaders. Now, that kind of dialogue and conversation that is happening at the national level, we need to see it getting down more, with more actors coming at the county levels and the like, because it requires multi-sectoral approach for us to be able to address some of those issues. And as you pointed, for example, in HIV and AIDS response, when we realized that there was such barriers, especially for learners living with HIV in school, because as we have a generation of young people who are born with the virus. They are in school. This is a stage where they're starting to probably have discussions around boyfriend, girlfriend, and all those kind of areas. So what we've actually done is to see that there is actually a guide to support learners living with HIV in school that is driven by the teachers and other actors within the learning institution. And that kind of partnership between the Ministry of Education and the Ministry of Health was instrumental in bringing together such a policy into effect. And now some of the actors like EGBA, we're actually supporting both the Ministries of Education and the Ministries of Health to actually support training of master trainers in the counties to ensure that the teachers are adequately trained, the principals of the schools and head teachers are adequately sensitized so that they can actually support the rollout. And part of it is that it also promotes that kind of conversation so that the learners can be better equipped. While it is directed at learners living with HIV, the content actually addresses all learners in learning institutions and therefore provides a room for the teachers to feel more confident and have the opportunity to openly talk to their learners about